Hello, everyone. My name is Judith Obi, and welcome to another exciting episode of SYNLAB Podcast. We are sure you enjoyed the previous episodes and podcasts. And today we're discussing something really sweet with amazing doctors. It's a sweet topic because we're discussing diabetes. And today with me, I have a fully loaded panel. Yes, there might be two, but they are loaded. And by the time I explain to you or read out their profile, you would understand. And to me, today is the amazing Dr. Sodipo Oluwajimi. Yeah. Did I get that right?
You got it just about right.
So, Dr. Sodipo Oluwajimi.
Yeah, I think that's better.
Yes,
you got it.
I got the whole. Yeah. So, Dr. Sodipo is a fellow of the West African College of Physicians. And he's currently the consultant family physician at LASUTH, that's Lagos State University Hospital in Ikeja. He coordinates a chronic medical disorder clinic with a large population of diabetic patients, and also coordinates a retroviral disease clinic. Interesting. He has special interest in chronic medical diseases such as diabetes mellitus, hypertension, obesity, amongst others. He's a member of the Nigeria Medical Association, Medical and Dental Consultant Association of Nigeria, Society of Family Physicians, Endocrine and Metabologist Society. I mean, there's a lot of societies. I mean, we know that today we made the right decision, so we're looking forward to hear from you. And with me here is the beautiful and amazing, unassuming mom of two. Wow. You know, I just found out she's so beautiful.
Thank you.
Dr. Afolabi-Obe Eniola. I got it right?
Yeah, correct.
She's a fellow of the West African College of Physicians, currently a consultant family physician at Lagos State University Teaching Hospital. She's also the team that runs the lifestyle medicine and wellness clinic in the hospital. And she has special interest in lifestyle prevention and management of chronic medical diseases like hypertension, diabetes, and arthritis, obesity, and all of that. And she has a lot of societies that she's also a member of. Wow. Society of Family Physicians, Society of Lifestyle Medicine of Nigeria. So much. A round of applause for this amazing panel.
Thank
you.
So
today we're discussing, like I said, a sweet topic, okay? And then, I don't even know if it's a misconception, this diabetes thing. Everybody just says, diabetes is because you have a sweet tooth.
Exactly.
And today we're going to demystify it, because even when I was having this beverage this morning, I was looking at your eyes before I asked for sugar. Before people now say, That's how it starts.
Yes.
So, Dr. Sodipo, quickly, what does diabetes mean, to you?
Yeah, so when we talk about diabetes, I think we'll just key in on DM, that's diabetes mellitus, because there's also DI, diabetes insipidus, but I think for this discussion, it's going to be DM. So I'm going to be using a lot of DM.
So it's not like you're coming into his DM.
It's not a direct. Yeah, it's not a direct message. This is diabetes. So so it's a condition where because of some challenges in the body, there's an inability for the body to be able to take care of the glucose levels that come into it. Okay. And sometimes that's due to the fact that what should take the glucose, which is what we get when we eat, we take our tea, we take our biscuits or something, into different cells, the brain, the liver, the kidneys, everywhere where it's actually needed. Yeah. So there's a problem with that. Okay. And that's usually due to a problem with insulin being produced. So that's one spectrum. Okay. We also have some people that have DM where they have all that, but unfortunately, it cannot work. It's just like having a key and having a lock. So they have the key, but the lock is spoiled, so the key cannot work. So they have the insulin, but it can't get in. So it's a condition that now leads to very high blood glucose levels, and that causes a lot of problems because the glucose gets into areas where it should not be going into, our eyes, the kidneys, so many other areas, and it causes a lot of problems. So in general, DM, you think of high blood glucose in terms of blood sugar, but I prefer to call it glucose anyways.
Glucose, yes.
And of course, it causes a lot of problems.
I prefer to call it glucose too,
yes,
not sugar.
Yes, I think that's better. So we wouldn't disqualify you.
Yeah. Doctor, do you have any other things?
Yes, as Dr. Sodipo has rightly said, he's not mincing words on most of the things he said. Yes, that it's clear that diabetes has to do with the way the body handles sugar.
Yes.
And then, like he said, is either the body is actually not producing enough of it, or he actually has it and it's not the body is not responding to what you have, even when you have it. So that's it for it.
And then, it's getting scary now, because when he mentioned, it gets into the eye, the liver, and the kidney, I'm wondering, that's crazy. What's the difference? And then, first of all, let's get to understanding or identifying it. Okay. What does early detection, what's the role it plays here in ensuring that we don't get to this point, okay, of whether the insulin is being produced or if it's going to where it's supposed to go? What's the role of early? Dr. Eniola, what do you think about the role of early detection here?
Well, I'll say that you don't know about something. You don't know how to take care of something except you actually have that thing.
Okay.
So I think let's start from that point, that except you get to know I have this, then I don't know how to manage. So early detection plays a key role. Like he mentioned the other time, that eventually it gets to the eyes, it gets to the kidneys, it gets to the heart. So what you're really careful about and what you don't want to prevent, you are trying to prevent or you don't want to happen, is actually the complications. Wow. And as you rightly mentioned, a lot of things in the body could be affected. Starting from the eyes, it could cause blindness. Yes, it could. It could cause blindness. It could affect the kidneys. It could affect the heart. Sometimes it could even affect erection. It could have issues with sexual dysfunction. Yeah, because it has to do with vessels. It has a lot of effect on the blood vessels in the body. So picking it up early enough, yes, we defer these things or we prevent them from coming up.
Wow, that's interesting, Dr. Sodipo. Picking it up early. What do you have to say about that? And also, what are the risks of this being either undiagnosed or diagnosed late? Is there any hope for late diagnosis? If it's diagnosed early, what's the possibility of mitigating this?
Yeah, so as Dr. Afolabi said, number one, to prevent complications. And unfortunately, what we're saying is that a lot of people are coming in with those complications. People come to the hospital, I want to check my eyes. I just feel I can't see very well. And we discover, you had diabetes. The damage has been done. We're seeing a lot of people with kidney problems. Diabetes is now number one cause of chronic kidney disease worldwide.
Really?
Yes. So that's a very big problem. And you only need to cast your mind to people, having to do dialysis and the cost of that. And it's something that is better prevented. And of course, other social issues, I should mention, erection and other things. And I think another thing that we're also looking at is that sometimes if you're able to, screen early and take a proactive approach, you could have a situation where you even pick up people that have pre-diabetes.
Oh.
Yeah, so already...
So like the stage before it gets to diabetes.
Exactly. So that's where, and, Dr. Afolabi, she does a lot of work with her team in terms of now putting in lifestyle measures to try to prevent the progression to diabetes. So I think that's critically important. And last but not the least could also be the fact that, if you detect it early, in some instances, it's a cost-effective way, because apart from the complications, you start drugs early, start the lifestyle, you could delay the progression. So it's something that, we're now trying to happen, prevention, early detection, because prevention is one component, but also early detection.
So guys, everyone needs to get tested.
Yeah,
okay. And then when we're talking about, because he mentioned before two different types.
Okay.
So is it safe to say there's type 1 and type 2?
Yes.
Okay. Correct. So can you talk about the different types?
Okay. Well, majorly, like he mentioned the other time, that it would coin down to the DM. We have the type 1. Commonly, the ones you really have, when you have about 5% of what you have usually is about the type 1.
Okay.
95% of people who have diabetes, usually is usually the type 2. So, and when you look about that, although we are saying that type 1 is majorly has to do with younger people, children in young adults, while you have the type 2 commonly in adults. Okay. However, now the type 2 is now becoming more rampant in younger people. Now we're finding a lot of, so it's not about just a particular age group restricted to the type 1 or the type 2. And for the type 1, it actually has to, it's just the body has the insulin, doesn't produce enough insulin compared to what you have in type 2, where you actually have it sometimes, and the body is not responding to what you have, not responding to the insulin that you have. And let me just, apart from the type 1 and type 2, the other ones that you may not really talk about, the one that happens in pregnancy, it's also something we should also be aware of.
Wow.
Yeah, in pregnancy, it could also come up, because like he said, that if you could pick up in pregnancy, sometimes it could prevent such an individual or such a woman coming down with it later on in life, or even the child. So we should also look out for diabetes in pregnancy.
I mean, we're going to delve into a lot of all these things much later. Just on the periphery, what are the predispositions? What makes people, predisposed to diabetes?
Yeah. So as Dr. Afolabi has said, so I'll just break it down: type 1, type 2.
Yes.
So for the type 1, those that affect younger people, and it could be even, we've seen some situations where even children, babies could have, and sometimes people are not even thinking along that line. Just this baby is always sick, or this child is always sick. So some of the for type 1, usually it's difficult to really place what predisposes people to it.
Yes.
And luckily, that's not the type that is too common.
Okay.
Yeah, so the type 2, we have some risk factors, and as Dr. Afolabi has mentioned, they're becoming more common now.
Mm-hmm.
So some of them include putting on weight. A lot of us are overweight. I mean, I've been checking my sugar level because when I went to, I always tell people, when you check your what we call body mass index, but that could be a little bit complex. Simply going to your tailor, to put the tape measure over your over the abdomen.
Yes.
Once one is a woman and it's more than 80 centimeters, that's already telling that, okay, I wouldn't call it pot belly, but that risk is already there.
Wow.
And for men, once you're getting more than 94 centimeters. So when we go to our tailors, apart from them taking our measurement, just ask that, please, what did you get when you measured? Yes, my tummy. So, so putting on weight is a problem, and we're getting a lot of that now. Technology, we sit down with lots, we're on the computer, we're on the phone.
Yeah.
Our diets, even now food is getting more expensive, but the unhealthy food is actually a little bit cheaper.
Easy to lay hands on as well.
Puff, grab one meat pie or something instead of taking a fruit salad or something. So putting on weight is one of the challenges. Another thing, as Dr. Afolabi has mentioned, is a situation where people have had maybe diabetes during pregnancy. That's another risk factor for it. Then we have a situation where some people have had challenges with their sugar level increasing gradually over time, like the pre-diabetes. Then some people too, there's a strong family history. So the family tree, somebody had diabetes, the risk is there. But in the past, what we've seen is a lot of people don't even know what happened to their parents. Now with technology, we know, okay, this is what happened. In the past, people just die, and they say, we rushed the person to the hospital, he died or she died. And they never knew that there was a history of diabetes. So that family history is quite strong. And now we're seeing a situation to where people are on certain types of medications, especially people that are hypertensive. So it's also a risk factor. So nowadays we say once you have hypertension, you also need to be, monitoring your glucose levels, because they are all part of the same pathway. It could also be due to some of the drugs that people are using.
Wow.
That's not the focus of this discussion, but we should have those kind of chats with our healthcare providers and say, I'm on certain medications. Are there any possible things that could arise? So those are just some of the risk factors that could occur, and they focus more on the type 2.
Wow, this is already a loaded session, guys. And I hope that in the subsequent episodes we're able to, delve deeper into all of this. Yeah. Thank you.
Thank you.
Thank you.